Hello, everyone.
Good afternoon.
Good afternoon, good morning, good afternoon, good evening, wherever you are joining in from. It's such an amazing day to have you guys on our discussion team today. I pray that you all benefit from this discussion. It's one of the areas that's really passionate to me and my team. And today we are here to talk to you about mental health and how to destigmatize some of the misconceptions that we have around mental health. I'm Dr. Eugenia Caternor. I am the host and moderator, and I have with me two speakers that we will introduce later on today. So if you are joining us on YouTube or Zoom, please relax. If you're on Zoom, make sure you mute yourself till the end if you have to ask questions. If you're joining on YouTube, if you get a chance, go ahead and subscribe to our website or our YouTube channel. Okay, so again, you're all welcome to Transformations Talk podcast. And it is a pleasure to have you all today. And today, as you all know, we're talking about mental health. So I'm not going to waste too much time, but our purpose for this podcast is to educate, to empower, to uplift, and to inspire each other. We invite people from all walks of life to join us, to teach us, and to discuss with us some of the things that we need or that will benefit us as humans. So if you're here today, pray that you will leave here knowing that you benefit from everything that we talk about today. So to not waste too much time, I'm going to go ahead and tell you a little bit about me. I'm Dr. Eugenia Caternor. One more time. I'm a family nurse practitioner and psychiatric mental health nurse practitioner. I am a co-owner of Kairos Embrace Behavior Health. We do mental health and behavior health management in Delaware and also in Maryland. So today I want to share a little light on what it is that we're about to talk about. So mental health, I know most people when it comes to mental health, we always think about somebody's crazy or somebody's having some spiritual attack. I'm here to define what it is, and then my team will also talk a little bit about the myth and then also what it's not. Okay, so definition about the difference between mental health and physical health. So physical health refers to the overall condition of the body, including your ability to function, your organs, your muscles, your bodily system working together as a team. It involves things like your fitness, your nutrition, the absence of disease. Okay, and mental health, on the other note, refers to the emotional, psychological, and social well-being. It involves how individuals think, how we feel, and how we behave, as well as our ability to cope with stress and interact with others. The key aspect of physical health is exercise, diet, sleep, immunity, substance, avoidance or absence of illnesses, and physical strength so we can get up and go around and do the things that we want to do every day. Mental health is stress management, emotional stability, cognitive functioning, self esteem, and resilience. And these are all what it comes together to encompass the physical health and then the mental health. Okay, how do we measure our physical health? We assess our blood pressure or we go through medical testings. We do our heart rate or we check our heart rate. We check how our body is functioning. In terms of mental health, we have to evaluate through psychological assessment. We can do emotional well-being skills where we can ask you a bunch of questions. So when you go to a primary doctor, you know they're starting to ask you things about depression. Are you feeling hopeless? Do you feel like you have no desire to do the things that you used to like to do? And they're starting to ask all those questions. It's an assessment to check your mental status. And also behavior observation. Sometimes we can just observe somebody and know that something is not right. And sometimes we are just down because something just happened or we've heard the bad news. Those are normal. But if that continues for a long time, then there is a problem that we need to reevaluate. Okay. So interconnection, if we know poor physical health, like when we have high blood pressure, when we have diabetes, high cholesterol, it can also lead to mental health issues like depression. Because if the doctor tells you, oh, you have cancer, you have 6 months to live, trust me, you will be depressed. Okay. You'll be stressed out. You have anxiety. So sometimes physical health can lead to mental health. And also, sometimes mental health can lead to physical health. So let's say you hear about, some bad news, or you lose somebody very dear to you in a family. That sadness can lead to depression. It can also make your blood pressure goes up. It can make your heart rate goes up. So they all work together. Physical health and mental health are important, and they are interconnected. So when we come to physical health, we are quick to go to the doctors because something is wrong. And then when it comes to the mental health, we're quick to rely on the church or prayers because we know something is wrong. But just the way you go to the doctor because something is wrong physically, that's the same way you need to approach your mental health. If not, there'll be an imbalance. Prayer is good, but if we don't balance the system, it's going to lead to more problems. Because when you have high blood pressure, you don't just pray that God heals you from the high blood pressure. You take your medication, you check your blood pressure, and make sure that things are getting better. It's the same thing when you have any type of mental illness or mental discomfort. We need to do an evaluation to make sure that we are getting the necessary treatment that we need. Okay, so people ask, what are different type of mental illness? So mental illness actually refer to a wide range of mental health conditions that affect a person's thinking, your emotions, your behavior, and the ability to function in a daily life. These conditions can be temporary, sometimes it's long term, and it varies in severity. Some people can handle it better than others. So it's not a matter of somebody's weak or somebody is not strong in the faith. It's just people express their needs separately and it affects all of us differently. And some of the common mental illnesses that people hear about or we get diagnosed with a lot of times are anxiety, including generalized anxiety disorder, panic disorders, or phobias. Depressive disorders such as major depression or bipolar disorders. We also have schizophrenia and psychotic disorders, which categorizes in the areas of delusions, hallucinations, and disorganized thinking. Personality disorders include borderline personality disorder, narcissistic, and antisocial personality disorders. We also have eating disorders like anorexia and bulimia, obsessive compulsive disorder, which characterized by having intrusive thoughts and repeatedly doing a behaviors. Post-traumatic stress syndrome or disorder is usually occurs after we experience trauma, like somebody was in a war, like the military people. Most of them do have PTSD as a result of the exposure they've had. People that have been abused or molested as children, most of them can also develop PTSD, which there's nothing wrong with it. It's a diagnosis and there is a treatment for it. Okay. So sometimes we are quick to brush off some of these behaviors, but if that continues to happen, it will affect us long term. So, in conclusion, before I hand over to our speakers, I would say mental health is also a medical condition. It's not a personal weakness, and with proper treatments and the support, we can overcome it. So, I'm going to hand over to Dr. Ruby Anumah to share a little bit information that she have with us, and then our other guest speaker, Mrs. Chioma, will continue from there.
All right. Good morning, good afternoon, wherever you're tuning in from. I'm excited to be here. I'm sorry my video is not working for some reason. The camera is not is not working, and I am technology. illiterate, just a little bit. So yeah, so this topic is very, timely. I would say it's very, very timely because we're seeing a lot of mental health issues. I mean, it's always been around. But first of all, let me go ahead and introduce myself real quick. I apologize. So my name is Dr. Ruby Anumah. I'm also a family nurse practitioner and also a psych mental health provider. I've been in nursing for almost 20 years. I can't believe it. I've been a nurse practitioner for 13 years, and this is a passion for me. I love to, engage the community in topics such as, this topic that we're discussing today. And I believe that, once you come to these kind of forums, you're definitely taking something out of this meeting. And if not, we need to make sure that we're also educating the community with things like this, like mental health. So today I really wanted to, touch base on some of the myth and the fact concerning mental health, because a lot of us, like Dr. Eugenia said, once we say someone has mental health, we're thinking the person has some type of look. We're expecting, like when we say someone has disability, we're thinking the person is coming in a wheelchair. We're thinking the person is coming, with an eye patch. But mental health doesn't have a look. Okay, it doesn't have a look. So I want us to discuss maybe a few myth and fact about what mental health is. And one of the first thing I want to talk about is, mental health being is mental health, is it a sign of weakness? No, it's not. It's not really a sign of weakness, but instead, it's a medical condition, just like Dr. Eugenia said. It's a mental is a condition, and every condition needs to be treated. So you can have someone that's diabetic and not check their blood sugar. You can have someone that's hypertensive and not be on blood pressure medication, because over time that illness is going to take their life, or it's going to destroy their well-being. So one of the important thing when it comes to mental health is strength comes from recognizing the problem. you know that is strength, when you have a problem. And the most important thing is recognizing that you have a problem and seeking help. Many people believe that struggling with depression, anxiety, or even trauma, like Dr. Eugenia mentioned, means you are not strong enough. It's not true. It really is not true. The truth is that mental health is not about willpower. But what we fail to recognize as, I want to say normal people, like if you're in the military, they say you're in the military, but if you're a civilian, you're a civilian. What normal people think is, mental health is means you're crazy. But there is something that goes beyond that. We're talking about brain chemistry. There are so many things that goes on in our brain. As we all know, we have hormones that play a specific role. And the body always has to be in some kind of homeostasis. So if the body is not in that homeostasis, then something happens. Okay. It can Chemicals in our brain, neurotransmitters in our brain, they cannot be too high or too low. Okay. So people that experience some of these mental challenges, there's definitely a root cause of it. Sometimes it's just a chemical in the brain that's not enough, or it's too much. And sometimes too it can be genetic as well. So this is part of the reason why there's certain types of antidepressant. We're saying someone is depressed, so the person is given an antidepressant, because we will have to feed them that that low juice that they have. Because if it's too low, then the person has a mood disorder. If it's too high, then the person is manic. Or so those are some of the reasons why someone may be having some kind of challenges with mental health. And some of the strongest and most successful people in history, I mean, we can go back on Google and search, from leaders to athlete. They are now coming out, speaking openly about mental health and their struggles. You may see somebody that is successful, like even Oprah, and you have no idea that she deals with any mental health issues. For all you know, she could even have what is it called, social, what is it called, that generalized anxiety. She could even have, like, fear of public speaking. I mean, people have all these things. So it's not always that the person, there is something wrong with the person, so the person is crazy, so then we're saying that this person has mental health issues. And I think there was one thing that I was talking to Dr. Eugenia about, talking about, if there is a physical part of you that is not working, like let's say your leg is broken, or your arm is broken, you're not going to walk on that broken leg. Obviously, you're gonna be in pain. You're going to hurt. So this is when you know that something is wrong with my leg. I fell. I broke my leg. I have to seek a doctor. The same logic applies when it comes to mental health. So there are people that are walking around. You see the person is, maybe they are happy at one time and then they are sad. There are so many things that goes on. And one of the things that I really like to talk to my patients a lot is this thing called seasonal affect disorder. It's a real thing. Okay, SAD, seasonal affect disorder. It affects a lot of people in this time of season because one, we are not seeing the sun anymore. Okay, it's cold, everybody is covered up, so you feel like, oh, and the interaction you during the winter time is less, compared to summer. So people actually go through these things where, their mood goes down, they are depressed, for the season, the weather. So these are all things that are real. Okay. And another thing that is a myth when people talk about mental health is, therapy is only for crazy people. I just had the discussion with Dr. Eugenia today. It's not that therapy is for crazy people. No. The fact is, therapy is for everyone, even for people that don't have any mental health challenges. I mean, I can't even say that we all don't have mental health challenges because for me, I know my own. We all have something, a little something here, a little something there. But therapy is one of the things that people frown on. Oh, why are you going to therapy? Why are you paying someone to talk to? Like I said, if it's broken, if your leg is broken, you're going to seek help. So there are certain things, certain factors in our life, even going through divorce, it can be astronomical. It can take an astronomical toll on a woman, on a child, on a man. It can take a toll on anyone that is going through that. So this is when therapy is, becomes a tool for self-improvement, emotional regulation, and even healing. So therapy is not for crazy people. It is not. Okay, it is not just like we go to the gym. I'm someone that works out, crazy, like 6 days a week. Just as we go to the gym for physical health, we also should invest in our mental wellness. And therapy helps us with stress, with relationship, personal growth, decision making. There's something called cognitive behavior therapy, and it helps, and it's tremendous for a lot of people. And like I said, therapy is not for crazy people. It is not. If you need it, there are people there that are trained. Okay, they have experts that are trained that can talk to you to resolve an issue. We have, therapy for conflict resolution, therapy for every and anything that you can think of. And another myth that I just kind of want to touch on too is, you know, people always say if you just pray and have faith, then guess what? You don't need therapy. That is not true. That is not true. Faith and therapy can work together. So these are some of the myths that we need to debunk. Seeking help does not mean that you lack faith. It does not. Especially for some of us that are from the Christian background. Yeah, prayer is the key. You go to God, you get on your knees, and you tell God what you're going through. But seeking help does not mean that you lack faith. It does not. It means that you are using the resources that are available to you. So why would God put someone in place for you to seek? If you need a surgeon, God put somebody in that position to do the operation for you. Same way, if there are certain things that you're going through, challenges that you're dealing with, there are therapists that are out there that are trained to be able to help you solve your situation. So, going to therapy doesn't mean that you don't have faith. It doesn't. So many people feel guilty about seeking mental health support because they've been told, just pray about it, or get over it. God will do it. Faith is powerful, but so is medical care, mental health. They are also powerful, and we have to always make sure that we're doing the physical and the spiritual part. Okay. Another myth that I want us to also talk about or even look at is children and teenagers don't experience mental health. That is so not true. It is so not true because mental health condition, it can start at any age. For some of us, we think that children are not watching. They are watching everything that is going on in the home. How the parent, how the mother, is treating the father, how the father is treating the mother. They learn through modeling. So mental health can start affecting a child at a very, very young age, even when it comes to, children that are born in the foster care. There is a pattern. We can see that these children or children that are born to, parents with drug addiction issues, we can tell that these children, they have a detachment, abandonment, and there is something called this Erickson stages where children have to go through, from infancy. We talk about trust versus mistrust. A child knowing that when they cry, they're going to be picked up, they're going to be loved, they're going to be consoled. That is where some of these issues that we end up having later on in life comes from. Some of these come from these experiences. So children, honestly, they can also have experiences dealing with anxiety. They don't want to be around certain people. Certain things scares them. They can go through depression. They can also go through trauma, just like adult. Dr. Eugenia mentioned about veterans that go through war. They come back, what they've seen. They have flashbacks of killing people or seeing somebody that is dead. Those are all trauma. And kids also they can also experience these kind of trauma. So, yes, children and teenagers, they also do experience these mental health issues. And now we're seeing like a rampant, of mental health affecting children, especially with this COVID times that we went through. A lot of children were born during COVID time. They did not have interactions with, the daycare system because everything was shut down. So these kids, if we're not picking some of these things up, it's going to go missed. And we're not going to see, children. And I was telling her today too that a lot of things that people exhibit, every behavior is a communication pattern. And children would exhibit depression or anxiety. They may exhibit it differently, but they may be acting out in school. They're not doing well in school. So we cannot just say that this kid is lazy. We need to figure these things out. So ignoring a child's mental health need does not make them disappear. I have to repeat that. It will not make it disappear. It just makes it worse over time, not dealing with the issue. I have a friend that is going through a divorce, and immediately I told her, what, you need to put your kids through therapy. Immediately, I'm telling you, when the separation happens, she puts her kids through therapy. Their kids are thriving. They have somebody that they can talk to. They have someone that they trust. Of course, trust is built with time. But these kids needs to go through this because sometimes it shows in the academics. It may affect the academics too. Okay, so yes, children and teenagers do have will experience mental health. And I'm not going to talk too much because we have another speaker that's also going to shed some light on this whole stigma when it comes to mental health. And the last thing I want to touch on is people with mental health illnesses are dangerous and unpredictable. We're thinking, where I come from, when you see someone that has mental problem, they are chasing you with a bat. They look a certain way. They look filthy, but that's what the movie and the media has portrayed mental health to be. It's scary. These people will kill you. But reality is most people with mental health are peaceful. For all you know, your boss is dealing with mental health. You would never catch that. And that same goes with addiction. There are people that are high functioning in society and they're addicted to cocaine, and you would never know, addicted to alcohol, because they can cover it up so well. So, people with mental illnesses are 10 times more likely to be victims of violence than perpetrators, honestly. So, these are some of the things that I know time is. I don't want to take too much time because I'm sure we're going to be having some questions. But those are just one of the five things that I think it's really, really important that we debunk as a myth when it comes to, mental health. Thank you.
Thank you so much, Dr. Ruby. And I really appreciate your input on this discussion because a lot of us hear about mental health, but we don't really know the details of what it is and what it's not. So thank you so much for sharing that
Absolutely.
information with us. And I hope that everybody listening today is picking something out of this conversation to know that mental health is not a bad name, and a lot of times it's nothing that you have caused to yourself. I think we have caused more to our physical health than we have to our mental health, because a lot of the health problems that we have, some of them we caused them because of our lifestyle and the things that we didn't do when we were supposed to do them. So don't blame yourself if you have any mental health problem. And when you see people with mental health problem, treat them just like a normal people, because they are normal. Like Dr. Ruby said, they are normal people. They are functionable in the community. So just pay attention to all that. Thank you so much again, and we appreciate you joining us today. I will hand over to Miss Chioma, and then when she finished, then we will have some questions at the end. So, Ms. Chioma, you can introduce yourself and tell us a little bit about what you do and also what you have for us today.
Thank you so much. Oh my God, the pressure. Ooh, Dr. Ruby, you came like a bazooka. I'm just like, can you just talk the whole 1 hour? Because, oh, came with like fire, but thank you so much for that intro. Okay, so I'm just gonna go ahead and introduce myself. My name is Chioma Snowbird Iroegbu. Yes, Snowbird is my real name. My mother and father gave me that name. I was not born in the winter. I would like to put that out there first, and then I would go ahead. Unlike the other two people who have all them doctors in front of theirs, mine is still coming. Will soon be there. I am a mental health nurse practitioner. I've been in the nursing field now for 11 years, and 3, 4 years of those I've actually been a nurse practitioner. I am very, very, very passionate about mental health, extremely passionate. A little backstory. Um, the the passion did not start overnight. Unlike a lot of people, I had my own mental health struggles. And yes, this lady had to also be on medications too. And I guess that was God just writing my story. And, one thing I always let my patients know when they show up is, you see that chair you're sitting on now, one day I was sitting on it, and now I'm on this other side. So if healing had actually and has actually happened for me, it can also happen for you. I have three tenets I believe in. I believe in medicine, I believe in therapy, and my foundation, I definitely believe in God. So I do not do the whole, do just medicine, do just this. No, those are my three tenets. Um, for me today, I will be talking on breaking the silence. And I'm actually a very visual person. So I went ahead and I created a PowerPoint slide. Let me see. I'm gonna go ahead and share that. Matchup was a compelling choice. I'm trying to find what I need to share. Okay. Dr. E, am I able to share now?
Yes, you are a co-host, so you should be able to share.
Okay. All right, that's fine. It's
You
not
click on
popping
it
up.
and share it,
Yeah,
right?
I don't know. It's just not popping up. It's okay. I can quickly just email that over to you if it's something you guys can project real quick for me. Okay.
Yeah, or maybe you can just go ahead and
Yeah, I'm actually just sending that over, and then I would go ahead. All right. So for me, I'm talking about breaking the silence, destigmatizing mental health. And personally with that, when Dr. Ruby spoke about when you break your leg, when someone breaks their leg and we're like, oh yeah, just walk it off. I actually share a lot with that experience because when someone breaks their leg, we're not quick to tell them just walk it off. The first thing is, oh, can I take a look at it? Have you been to the hospital? Have you taken medicine? It's so many questions that we actually ask them. But then when it comes to mental health, it's something that actually affects everybody. stress and sadness. And, you have people who are depressed and you have people who are anxious. But then everyone is whispering, nobody wants to talk about it. It's like that big elephant in the room that, oh, yes, shoot, turn the volume down. No, 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 no. Oh, people would think you're crazy. Don't talk about it. And, it really, really hurts me a lot when I hear words like that. I always tell people, one example I love to use is if someone has a headache, no one is quick to tell them, oh, keep quiet. Over here is, have you taken Tylenol? But then it's, with mental issue, no one wants to actually understand and know what's going on, what phase of life are they in. So till date, I find it very, very amazing that we are what in year 2025 and um talking about mental health is still very awkward for many people. I mean, for someone like me that grew up in Nigeria, I know till date, some people still see it as spiritual problems. Now, I don't negate that there's that aspect of it, but there's trauma, there's PTSD. I don't know about you, but I know some parents and some teachers that whooped the living daylight out of people. And that has actually created some traumatic experience for people. That's mental health. I know clients and everyday contacts that I meet who have actually gone through rape. And when you hear the people who raped them, it's like, wow, that creates trauma. That's PTSD. That's mental health issue. And we still have people telling us, oh, don't talk. Oh, I mean, if someone has asthma, you don't tell them, just breathe better. If someone breaks their arm, you don't tell them, maybe you should try and think positive when next you're riding your bicycle. If someone needs glasses, you don't go ahead telling them, oh, have you tried focusing harder? No. So when it comes to mental health, all of a sudden it sounds ridiculous. And for me, it's like, that's why we need to change the way we talk about mental health. We cannot just sit on our hands and think, oh, it's from years ago, it doesn't matter. No, it matters. Um, Mental health for me is not just about mental illness, it's how we handle stress. Stress from school stress, people who have exams, work. I don't know about some of you, but work can actually be very stressful. You have work deadlines, you have um, work meetings that you have to prepare, and then let's not forget the most important stress that a lot of people go through daily: family drama. Yes, family drama. Relationships, friendships, dating, family interactions, those can actually be stressors. One very, very important question I ask people whenever I'm doing a mental health assessment is, the first time I see them, I always ask them, any stressor? And it sounds very foreign when I ask them that question. But, first I get the weird stare, and then, they start talking. And subsequent sessions, I keep asking them, any new stress? Any new stress? Any new stress? And it's always, oh, yes, yes, yes. Oh, and then this is going on, and then that is going on. So stress definitely plays a very, very big role on our mental health. Um, Also, decisions we have to make. It can actually play a very big role. So, good mental health doesn't mean being happy 24/7. That's also something that a lot of people think, oh, yeah, if your mental health is good, you're going to be happy 24/7. No, 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 no. That's not what it means. Good mental health just means that, you're able to balance life. It means you're able to navigate life's ups and downs without feeling overwhelmed. I know, I know Dr. Ruby had touched a little on some myths, so I'm not going to spend so much time here. Of, I think I have like three, and I'm just going to touch base real quick on those three. So, talks about one myth a lot of people share is the fact that um, mental illness is rare. It's actually not rare. 1 in 5 adults actually experience mental illness each year. If I'm being honest with everyone here, there is actually somebody that you know that is struggling and they're not able to talk about it. So, one in five, I mean, we are a total of what, 32 people? So, one in five people actually struggle with mental illness. The next myth, therapy is for crazy people. Firstly, I hate that word crazy when clients show up and they go, "Oh, yeah, my family thinks I'm crazy." I tell them, I'm like, "You see that word? We don't use it in here. I don't like that word crazy." Therapy is for everybody. You really don't even need to have mental illness to actually go for therapy. Sometimes you just need someone to talk to. Sometimes you just need a safe space where you can talk. And then sometimes you need that talk so you can be better. Athletes have coaches, singers have vocal trainer. Your brain also deserves a professional too. It just doesn't deserve, "Oh, okay, we're going to calm down, we're going to figure it out." No, sometimes your brain deserves a professional also. I mean, there's a reason we went to school. The last myth I'm going to talk about is talking about mental health makes it worse. That's not true at all. Actually, talking about it helps. Now, people have issues because they confined to the wrong person, and then it feels like problems abound, and now they're, whatever they've shared is now everywhere. But no, silence fuels stigma. The reason we're trying to break the silence is because there's this bad stigma around mental health. If we can all speak up, we create support, we create solutions. It's different when it's just a mental health practice that is just doing it. If everybody can speak up and say, "Well, you're not crazy, something is just off. I know someone who can help you. Trust me," the stigma would break. How do we break the silence? We normalize conversations. We talk about mental health as much as we talk about physical health. As people grow, I hear them say, "Oh, now you have to take your blood pressure serious. You have to be checking your sugar level. Diabetes and all that will creep up. The reason you check your blood pressure is because of stroke and this, that, that." If we are so passionate about physical health, then we should be passionate about mental health just like this. There are people who go through divorce and they struggle. That's also their mental health going bonkers. You have to be able to be compassionate to help them. Another way, watch your language. Replace phrases like, "Oh, just get over it. You're a man, be strong, don't cry." Replace those phrases. Be that person. You can tell them, "I'm here for you." You can let them know, "I might not have the words, but can I send you to someone? Can I refer you to a professional?" Another way to help, educate yourself and others. See, AI has made life so easy for us. There is Google, Chat GPT. You can just go on there and tell it, ask it questions, and it can help. So it's the same way you can ask questions and say, "How can I speak to someone who is visibly depressed and I don't have the right words?" I hear so many people tell me, "I'm not compassionate, I'm not this, I'm not an empath, I'm not this." Well, but someone is struggling. You know, I've seen someone on the side of the road who did not know how to do CPR. But guess what? When it turned to his family member needing CPR, he did not remember, he did not know how to do CPR. He looked it up, he jumped on that chest, and he started doing CPR. So, physical health. But now, mental health, we hear crickets. Lead by example. Be open about your own mental health. I guess, God had to have me do my Egyptian journey so that I will make it to the land of Canaan. And now I hold on dear to that word, that the Egyptian you see today, you shall see no more. And yes, I am leading by example. I am talking about my struggles. I am talking about my journey. And above all, I'm so proud that my journey did not end me. I'm still going on. Checking on your friends. Checking on your friends. How are you? Ask questions. How are you? How are you doing? Would you like to talk? Yes, I hear I'm not a texter, I'm not a this, but it doesn't cost much to check in on people. Social media. Social media is a powerful tool for spreading awareness, but it can also create unrealistic expectations. Um, no one's life is perfect, okay? Now, social media, I use it to my benefit. I'm on there and I'm raising mental health awareness and also talking about how God had saved me. I go on there and I see people do different things. I mean, today on TikTok, I think everyone is just on there talking about how much money they are making. But sometimes I filter what I see on social media because it can engulf you. There was a time when OnlyFans was a taboo, and now you have people who are so not ashamed to be talking about being on OnlyFans and doing some despicable things that I feel people should not be doing. So no one's life is perfect. Use social media to your own good. Now, if it's affecting your mental health, please edakun, log out, log off, remove it. You will not die because you left social media. Just whatever can keep you sane. That's where you need to be. Um, Personally, I also feel mental health should be something that is taught in schools. They teach math, they teach English. Well, they also need to teach about your mental health too. Um, they also need to teach it in workplaces. A good portion of adults that I see that show up, for counseling, for medication management, a lot of their struggles came from their work, burnout, stress. I also indulge companies to create safe spaces. The people that work for you, they are not goats, they are not cows, they are human beings just like you and just like I. So create a safe space for them. Lastly, or second to the last, as I begin to close, like my pastor used to say, self-care is not just a buzzword. Self-care is not being selfish. Take care of yourself. You know, so many adults have grown to a point where they don't have hobbies. People don't even know what a hobby is anymore. But I know when I was younger, we could, oh, what are your hobbies? I like dancing, I like music, I like this. These days, when I ask people, what are your hobbies? They just stare and they're like, hobbies, wow, people still have those. Yes, you need to have those. As easy as going to get a massage, as little as getting a bubble bath, even if it's like face routine, self care routine, go ahead and figure something out and do. For self care, too, learn to set boundaries. The African in us makes us feel like saying no is a crime. My dear, if it will affect your mental health, please say the no. No, don't go carrying extra load on yourself that you cannot, handle. Set boundaries. It's not just only saying no. Set boundaries. Um, Sleep. Get enough sleep. Most clients who end up with bipolar disorder, they are not sleeping. So sleep. Research has it that even as an adult, you need at least 7 to 8 hours of sleep. Please sleep. If you can take naps, take naps. Move your body, be physically active, work out, do something. Don't just sit on the couch, sit on your decks all day, pressing the computer. Stand at least 30 minutes of, brisk walk a day can do so much good to you. Lastly, ask for help. There's so many professional services out there. Prayerfully find the one that would benefit you. I run, I and Dr. Eugenia, we run a Christian faith-based mental health practice in Delaware and Maryland. You can always reach out to us if you want us to pray with you. We're very much open to practicing under the confinement of God's will. Lastly, be the change that you're looking to see. Okay, don't just sit on your hands anymore. If if you know much about mental health, if you've struggled with it, you don't need to tit for tat share your whole story out there. But if you see and you know somebody that can benefit from you just holding their hands or you just giving them the right advice, please go ahead and do it. It starts with you, it starts with I. We cannot break this stigma if everybody's closing their mouths, if everybody is looking the other way. We can only break the stigma if we all talk about it. Thank you so much.
Thank you so much, Ms. Chioma. This is very helpful, and I believe we've all learned something from the information that has been shared. It's not a one person job, it's everybody's job, whether you're a professional or you're not a professional. And Chioma have hit all the nails that need to be knocked down. So please, the stigma around mental health is not true. That if you have mental illness, that means there's something wrong with you that cannot be cured, or because the devil have found their way in you. Yes, there may be a demonic or spiritual portion to why you have mental illness, but I'm sure there's also demonic and spiritual portion where people have cancer and people have all other sort of problems. So just as you treat other conditions, we need to treat mental health. Before we end, I also want to talk a little bit about our children and our youth. You know, silence doesn't fix mental problems. So if you're a youth, if you're a child, and you're listening, please make sure when something is wrong, you talk to your parent. If you don't feel comfortable talking to your mom, talking to your dad, find an adult that you can confide in, somebody that you trust. It could be your guiding counselor at school, it could be a mother figure, a father figure that you have in your life. But silence is not going to fix your problem. Talk to somebody. Don't think you're doing something wrong. Don't think it's something that you did that has caused the problem. You know, because sometimes when we're going through some problems or dealing with some abnormal behaviors, and a lot of our African parents are quick to start criticizing and judging the children, saying, you have food to eat, you have roof over your head. What do you mean you are depressed? Trust me, just like they come to you with headache and stomach ache and you take care of them, when they come to you that they are depressed, when they come to you that they need to talk to a therapist, when they come to you that something is not right, please don't brush it off. Don't ignore it. Please seek help for them. If you see that they've changed in their behavior, if they used to be active in sports and different extracurricular activities, and all of a sudden there's no more interest in those things. If you see them in their room too much than normal, if they stop eating or they are just not talking like they used to do, please, those are their means of communication. They are talking to you. They are crying out for help. So when you see these changes in your children, don't take it for granted. Don't say, oh, because they are teenagers, or don't say, oh, my friend's kids are the same. Don't compare your child to anybody. Don't compare your wife to anybody. Don't compare your husband to anybody else, because we are all different and we deal with situations and issues differently. If you're going through a problem, please, as our speaker said, find somebody to talk to. We all have people in our lives that we can trust. If you have health insurance, insurance covers mental health treatment, counseling, therapy, you know, psychiatric treatment. Insurance covers it. And to be honest with you, mental illness or mental problems are one of those things that even if you don't have insurance, you can get coverage for it. There's a lot of help and a lot of resources out there that you can tap into to get help. You can get help for mental problem faster than you can get help for physical problem, you know. So don't be in this hole alone. If you're not sure whether you do have a problem or not, just talk to somebody, because we do assessments, we do evaluations, and we talk to you. We provide patient-centered care approach where it's you that is telling us what is wrong with you instead of us telling you what is wrong with you. So I would say, you know, church helps, prayers help, spiritual battle helps, but sometimes we also need the medical and therapy portion to make it complete. So don't ignore your mental health. For the past year, I've been to so many funerals for children and youth than I've been ever in my life. And it's very heartbreaking to see children die from suicide because the parents are not listening to those children. And then the parents will hide it even after they are dead, saying, oh, it wasn't suicide or something else that caused it. Please, Don't be ashamed if you need help or your children need help for their mental well-being. It is something that has been going on, and our goal is to advocate for each other. Our goal is to educate ourselves on how to get help. So if you need help, we have the website on the charts. I don't know if Mr. Biner is able to put it up for Dr. Ruby and also Ms. Chioma and myself. If you need to contact us for any advice or any questions that you may have, because our programs are faith based. So we do talk about God in our meetings, we do pray. So if your concern is you don't know who is going to be talking to your child, or you don't know who you're talking to make sure they believe in God, yes, we all believe in God, and we all believe that God is a healer, and then we incorporate the medication if we need to. And also, it's not everybody that have mental illness that have to take medicine. As our speaker said, sometimes you just need somebody to talk to, especially if you're going through divorce. Remember, you're not the only one struggling with the divorce. Your children are also struggling. They see what has been happening, they see the fighting, they see the arguments, so they are also affected. So don't think I can go through this myself, or I'm okay, I'm fine. No, you're not fine. You're not fine. Seek help. Help is out there, and anybody that just don't even know where to go for help. There's a lot of information online. As Chioma said, ChatGPT can give you some information. Google, what Alexa, they can all just ask it, hey, where can I find a faith-based or a therapist near me, or a mental health provider around me? If you're from Africa and you want an African therapist because they understand you better and they know where you're coming from, there are a lot of them out there. There are more of them now than they've ever been, because a lot of them are understanding the importance of mental health and how it has robbed our society for years. So please, let's all get the help we need. If we need to get help, please don't ignore it, don't procrastinate, because just like if you don't check your blood pressure for a long time and you think you're good, one day you check it, it's high. They put you on medication, you stop taking the medicine because it goes down. Trust me, it will go back up if you don't do the right things. Or just because you're physically okay, it doesn't mean you're mentally okay. So please seek help when you need to. And just know we are all here for each other. We are here to support you. And there's no judgments, there's no discrimination, and that stigma have to go down. So if anybody have a question, we'll have room for maybe one or two questions, and then we will end our section for today, because we only have 5 more minutes. So thank you so much, Dr. Ruby and Ms. Chioma, for the wonderful presentation. God bless you. Okay, I see Sister Namika have her hand up. What's your question, ma'am? You're mute. Can you unmute yourself?
I say, thank you, good afternoon. I say, that's not Sister Nemeka. It's Brother Nemeka. Can you hear me?
Yes, we can hear you.
All right, thank you. I have a question, but first off, I want to say thank you for the lecture. It has broadened my knowledge about mental health. So, my question is that from the lecture, it means a lot of people have this mental health challenge, but they don't know. For instance, for somebody that is at what stage can somebody want to see a therapist, maybe from work stress or some decisions or some thoughts that is having? At what stage can the person say, this is affecting me at this moment? What are the symptoms the person can see? Say, maybe I would like to see a therapist.
So that's a very good question. And my thing, how often do we go to see a doctor for our physical health? We go see a doctor once a year to make sure everything is okay. We see the dentist twice a year to make sure our teeth looks okay. We clean our teeth. We see the eye doctor once a year, even though we wear glasses, or we realize, oh, my vision has changed, or my vision is blurry. We go and see an eye doctor and they do an assessment, and then we get glasses if we need to. The same way, whenever something is not normal, so if in terms of your mental health, if you're the kind that gets up, go to work, come home, eat, you're happy, everything is okay, and all of a sudden you realize that you come home and things are different, or you notice that your spouse or your children look different, then you can start assessing evaluating the situation. It's okay, something is wrong. So if you as a person, your head is hurting, you know it, your stomach is hurting, you know it. The same thing, when you're going through some situation mentally, you can tell that something is not right. So when you go to the doctors to check your physical health nowadays, and I've noticed a lot of doctors, part of the screening is to screen for depression, to screen for anxiety, to screen for substance use disorders. So if you're honest with yourself, when the doctors start asking you, are you feeling hopeless? Are you losing interest in the things that you used to like to do? Are you sleeping more or not sleeping at all? Are you eating more or not eating at all? Has anything changed in your normal activity levels? Somebody, it could be in the morning, they don't want to get out of bed. If it's a job that you used to love, all of a sudden, you realize that even when you go there, you are moody, you're upset. The care that you were providing to your clients, you're not able to provide that care anymore. Start thinking, okay, something has changed. So instead of you saying, oh, it's going to get better, oh, I know what it is because I lost my mother, or because my wife is doing something, or because we have a child that have a, special needs. Yes, all those things can affect your mental health. So it's better for you to go check it out, to just talk to somebody. At least start with a therapist. Also, the therapist can do their own evaluation as well and start asking, like Chioma said, has anything changed? Are you having any stresses? And it could be, sometimes it could be a financial problem. Like you used to have money, all of a sudden you lost your job. Money is gone. Your bills are behind. People are calling you here and there that they need money. That's very frustrating. And that's very, overwhelming. And sometimes that alone can make you want to seek help and just talk to somebody. So I believe we all need to talk to somebody at some point in our life, even just to talk about everyday things. Or how can I improve on this? Or I realize that my children are not connecting with me like they used to. Okay, did you check into yourself? What am I doing wrong? What am I doing different? Maybe I need to get help so I'll be able to be a better parent, or a better employee, or a better friend to other people.
Okay.
I hope that answers your question.
Good. Thank you.
You're welcome. Where are you joining us from?
You see?
Where are you joining us from?
Oh, from Texas. I'm from
Texas.
Texas, yeah.
Okay, thank you for joining us.
You're
Okay.
welcome. Thank you.
Any more questions? We can take one more question and then we'll end and continue with this discussion another day. Okay. Our time is up. It's 2:30. So if we don't have any more questions, I will say thank you all for joining us. And as always, Transformations Talk podcast is a platform where we talk to people, or we have people come on to share their experience with us, educate us, inspire us, and empower us. So you can look us up online, and you can also visit my website, www.dreugeniacaternor.net. All the flyers or events, links to the podcast, links to the YouTube, everything is there. You can also subscribe to our YouTube channels. And I just want to say thank you to everyone that joins us today. And also thank you to the team that worked with me, very, very, hardworking, and I cannot do this without them. So thank you all for coming today, and I pray that you enjoy the rest of your day and your weekend. Bye for now.